The vast majority of what I would call popular Medicare content out there seems to revolve around Advantage versus supplement plans. These are the two options available to cover the gaps that original Medicare does not cover. But we see a lot of comments from people who say that they don't even want to bother with Advantage or supplement plans or even Part D prescription drug coverage, and they're just going to go with original Medicare only. Everyone is entitled to their own opinion, and we welcome all opinions. In this video, we're going to go through a few cost scenarios and figure out what it would look like with only original Medicare compared to the costs with Supplement Plan G or an Advantage plan. I do need to say that there are almost infinite variables here, so this is our second video of our series of sorts where we will tackle some common medical situations and break down the costs. Feel free to throw in the comments if there's a specific situation that you would like us to break down. To start the conversation, we have to talk about premiums, the dollars that you need to pay just to have any coverage at all. With all three of these plans, you will have the Medicare Part B premium, which in 2023 is $164.90 per person per month for most people. This is income-based, but we're going to go with the majority of people here. So those with higher incomes could have a higher premium. That comes out to $1,978.80 per year, and again applies to all three of these plan scenarios. All right, a Medicare Supplement Plan G is what we will use here because it is by far the most popular across the country right now. In our area, they average about $150 per person per month for a 65-year-old. There are areas where these are pushing $300 per person per month for a 65-year-old, so where you live matters when it comes to these plans. This premium will also increase a little bit most years, so know that it does go up, but for this exercise, we're going to put in here $1,800 per year in premiums, and that is that $150 per month. Finally, most Advantage plans are $0 premiums. This varies a lot by where you live, and there are plans with premiums, but 69% of all Advantage plans across the country have $0 premiums. The next thing to consider are deductibles. A deductible is the dollar amount that you need to pay first before any help comes, with the exception of some preventive services. Original Medicare has two of them, the Part A deductible and the Part B deductible. The Part A deductible applies to inpatient hospital care, skilled nursing facility care after an inpatient stay, some home health care after an inpatient hospital stay, and hospice care. In 2023, the Part A deductible is $1,600 per benefit period. This is not an annual deductible like what you've been used to your entire life. The benefit period begins once you've been admitted into the hospital, and it ends once you have been released and out of the hospital for 60 consecutive days. So let's say that you go into the hospital on January 1st and you stay for 3 days and you are released January 4th. If you need to go back into the hospital as an inpatient for whatever reason on or after that 61st day out from January 4th, you are now in a new benefit period and you would have to pay that $1,600 deductible again. So the point is, with hospitalizations, you could have to pay that Part A deductible multiple times in a year if you have original Medicare only. The second original Medicare deductible is the Part B deductible for all of your medical services. In 2023, the Part B deductible is $226. This is a much more straightforward deductible because it is an annual deductible, meaning it only applies once in that year and it resets each January. So that wraps up original Medicare deductibles. Let's move to Plan G. A Medicare Supplement Plan G has one deductible, and that is the Part B deductible of the $226 in 2023 that we already mentioned. Your supplement plan would cover your Part A deductible for you. Finally, with an Advantage plan, remember that it is replacing original Medicare. With most Advantage plans, you do not have a deductible and coverage starts immediately. Now, there are two types of copays involved with original Medicare Part A. One is specific to inpatient hospital stays that last longer than 60 consecutive days in the hospital. It is a $400 copay per day that you are in the hospital from days 61 to 90, and an $800 copay per day if you are in the hospital for days 91 to 150. There are days called lifetime reserve days here, but that is for another video. The second Part A copays are related to skilled nursing facilities. After that weird Part A deductible, original Medicare covers days 1 through 20 in a skilled nursing facility 100%. For days 21 to 100 in a skilled nursing facility, you are responsible for a $200 per day copay in 2023. After day 100, so 101 plus, you are then responsible for 100% of the cost. Okay, let's Let's move to Part B. Part B covers 80% of all of your approved medical procedures. You are responsible for the remaining 20% with no out-of-pocket maximum. This is important. A supplement plan G does not have copays or coinsurance amounts. Advantage plans have copays for most services, and they are highly dependent on where you live and the plan that you have. We looked at several here locally and then took an average of them for the numbers that I'm going to use in this video. The last thing to mention was alluded to earlier, and that is a maximum out-of-pocket cost. This is a dollar amount where once you personally have paid this much, insurance would then take over 100% responsibility for covered services, and you no longer need to pay anything for that year until that resets in the new year. With Original Medicare, there is no out-of-pocket maximum, as we mentioned. If you face a $1 million Part B claim, Medicare covers $800,000, which is 80%. You need to come up with $200,000 or that 20% coinsurance. With a supplement plan, the out-of-pocket maximum does not apply. With a Plan G, once you meet that Part B deductible, any Medicare-approved expense is covered 100%. So your $226 Part B deductible is sort of like that out-of-pocket maximum for the year. With Advantage plans, out-of-pocket maximums do apply. They are all over the place depending on where you live. I've seen as low as $500, which is crazy low, and the maximum in 2023 is $8,300 for in-network services. The average in our area is $5,500 as the out-of-pocket maximum. Again, there are some higher, there are some lower. We're going with the average for this example. All right, we've got all of the preliminary stuff out of the way. I think you can already see that there are some significant holes in Original Medicare, so let's see how this goes. We'll start with something small like a specialist doctor visit, and then we're going to increase in severity here. So we'll move into a surgery, then to an inpatient hospital stay, and end with something catastrophic like cancer treatment. To keep this video under an hour, we are going to skip over a few minor costs and focus on the major costs that people would see. So let's imagine that you start feeling a little bit weird and you need to go see a specialist for an initial consultation and then a follow-up visit. So 2 specialist visits. The specialist costs are all over the place, but let's say that it's $250 per visit to see the specialist for a total of $500 billed for these services. With just Original Medicare, Medicare would cover 80%, so $400, and then you would be responsible for $100. With Medicare and your supplement plan G, Original Medicare covers 80%, so that $400. And since you have that $226 Part B deductible with a plan G, you are still responsible for the remaining $100. With an Advantage plan that has now replaced Original Medicare, Medicare pays $0 for this procedure. The average specialist copay with the plans we are looking at was $30 per visit for a total of $60 you would need to pay, and then the Advantage plan takes care of the remaining $440. Remember that those $60 that you pay are now going towards your plan's out-of-pocket maximum of $5,500 in this example. You now have $5,440 left to meet your Advantage plan out-of-pocket maximum. All right, now it's time for you to have a surgery. We have a video that covers these costs in a lot more detail. There are several moving parts to a surgery, including more specialist visits, physical therapy, and imaging that we just don't have time for in this one. So just know that they are there and that those costs are happening, but we're just gonna look at the surgery itself, which in our other video was a $24,000 bill. With just Original Medicare, Medicare would cover 80%, which would be $19,200. You would be responsible for the other 20% or $4,800. With a supplement plan, that $4,800 gets passed along over here to the plan G specifically. Since in this example you haven't hit your deductible yet, you would be responsible for $126 to meet that $226 Part B deductible, and then your plan would handle the remaining $4,674. With an Advantage plan, the average outpatient surgery copay for those plans that we looked at was $350. You would pay that, so $350, which comes off of your maximum out of pocket, and leaves you with $5,090 left to meet that maximum out of pocket. And then your Advantage plan covers the remaining $23,650 of the surgery itself. At this point, it is pretty clear that Original Medicare only is already a lot more expensive. Now let's move on to an inpatient hospital stay. An accident happens, something goes wrong, and you end up in the hospital for just 3 days. According to healthcare.gov, the average 3-day hospital stay costs around $30,000. Yikes. Part of that is a facility charge and part of that is a provider charge, meaning that a portion of that amount is a Part A charge and a portion of it is a Part B charge. For this example, we're going to say that $20,000 was a facility charge and $10,000 was the provider charge. With original Medicare only, you have that $1,600 Part A deductible that you would need to pay, bringing the total Part A charge Medicare will cover to $18,400. Medicare will cover 80% of the Part B charge of that $10,000, so you would be responsible for $2,000. Moving to the supplement plan, Plan G will cover your Part A deductible, so you don't have to pay it, and then you have already met your Part B deductible in the previous charges, so you don't have to pay anything out of pocket for this surgery. That's pretty awesome coverage right there. Now to the Advantage plan. Most Advantage plans have a daily copay for inpatient hospital visits, and it's a range of days. We have some plans here that are X amount of dollars per day for days 1 through 3, and then the plan covers the rest. Other plans are for days 1 through 4 or 1 through 5. It all depends on the plan. The average that we took is $350 per day for days 1 through 5. So you were in the hospital for 3 days. That means that you would have $1,050 in copays for the hospital visit. These inpatient copays cover all of the services obtained while inpatient. So if you had tests, the physician costs, these are all covered by the copay. This means that the plan covers $28,950. From our math perspective, that puts us at $4,040 left to hit our out-of-pocket maximum for that Advantage plan. All right, it's been a rough year so far in this example, and now it gets worse as we move into cancer. Cancer has a lot of variables in the number of doctor visits that you could have, the types of treatments that are available, the number of treatments, and the length of time for that treatment. Some estimate the average cost for the first year cancer treatments at $43,000. We've seen some jumping into the hundreds of thousands of dollars, so I'll do my best here. I don't have an actual patient bill for this one, but let's say that the total cost was at $60,000 for that year. That's made up of chemotherapy drugs, doctor visits, specialist visits, imaging, and several other types of care, most of which are most likely Part B costs. Assuming Part B only on this one, original Medicare covers 80%, so $48,000. You are responsible for 20% or $12,000. Moving to the supplement plan G, you have met your Part B deductible. Your supplement plan covers you 100%. Can you see why so many people love supplement plans so much? If something catastrophic happens, that is unbelievable coverage. Now, your Advantage plan costs will be broken out between copays for doctor visits, imaging, etc., and coinsurance for chemotherapy drugs infused at the hospital. If you've made it this far, this is all over the place again, so I'm doing my best to give an idea of what these costs could be in a short amount of time, which means that you'll have plenty of opportunities to say, whoa, wait a minute, you didn't mention this, you didn't mention that. There's no evil motives for skipping some of these things, it's strictly time. All right, so imaging, CT scans, and MRIs are common with cancers. CT scans can be every 3 to 6 months. So let's say that you get 4 in a year. Average cost for a CT scan around the United States is $3,000. The average plan copays that we have here are $50 for each scan. So for 4 scans, you pay $200. Your plan pays $11,800. MRIs are all over the place as well when it comes to costs. So let's say that it's $1,300 for a scan. You'll likely get 2 of these in the first year of diagnosis and 1 per year after that. So we'll use 2 here for this year. Same copay as the CT scan, so $50 per visit for a total of $100, while your plan pays $2,500. So for scans, we're at $300 in copays, bringing that amount to hit our out-of-pocket maximum on the Advantage plan to $3,740. Here's where things get tough for Advantage plans with high out-of-pocket maximums. Chemo drugs are typically covered at 80% by the plan with a 20% coinsurance to you. Let's say that the chemo drugs cost $30,000 in this example. The plan will cover $24,000. $6,000 is your responsibility up to that out-of-pocket maximum. Because of your previous cost-sharing responsibilities and what's left with your out-of-pocket maximum with this Advantage plan, this means that you need to pay $3,740 of that $6,000, and the plan will cover the remaining $2,260 as well as the $24,000 on top of that for a total of $26,260 covered by the Advantage plan. You have now met your Advantage plan's out-of-pocket maximum in this example, so any other covered treatments will be covered 100% for the rest of the year until January 1st of the next year, where all of the levels reset. All right, let's look at the totals for this chaotic year. The total bill for what we've gone over is $114,500 for that year. If you just have original Medicare, Medicare covers $94,000. You are responsible for $20,500 plus your Part B premiums of $1,978.80 for a total of $22,478.80 if you just had original Medicare and nothing else. All right, what about a supplement plan G? Well, of the $114,500 bill, original Medicare still covers $94,000. Your supplement plan covers $20,274. You are responsible for that $226 Part B deductible, plus the Part B premium of $1,978.80. Plus the supplement plan G premium, which was $1,800 in this example, for a total of $4,004.80 as your out-of-pocket costs. Much, much less than just original Medicare, like 82% less. Finally, with an Advantage plan, you'll notice that your break-even point is somewhere along this spectrum depending on how much care you get, but of the $114,500, the plan pays $109,000. You are responsible for the $5,500 out-of-pocket max in this case, which was made up of co-pays and co-insurance along the way, plus your Part B premiums of $1,978.80 for the year. In this case, the Advantage plan did not have a premium, but if you do have one that has a premium, you can add that in here. So the total in this example is $7,478.80 if you were to go the Advantage plan route. Way less than original Medicare alone, a little bit less than double a supplement plan in a bad year. You can guess where we lean when someone asks if they should risk it and just stay on original Medicare with nothing else. That is a much bigger risk than what we are comfortable with and what we are comfortable recommending. But this whole conversation revolves around your risk tolerance, and your health. If someone is healthy and nothing ever goes wrong, they would be paying money for insurance that they don't use. If somebody has severe health issues, they get a significant return on their investment by having these coverages. Most fall somewhere in between, so you'll need to balance your comfort level with risk with the options available to you in your area. This video, like many others on our channel that go over dollars, is just that, strictly dollars. There are a lot of other factors that go into these decisions, including the ease of use, networks, customer service, and much, much more. So always work with an agent to find the plan in your area that would work best for you and your situation. That would include your finances and your health. We have other videos that go into these other circumstances in a lot more detail that you can check out if you so choose. We'll be putting out more videos like this one that go over different common conditions and how different plans will cover them. So if you found this helpful, maybe consider giving this video a like and subscribing to the channel to see more. If you have any recommendations of things that you'd like to see us compare costs with, feel free to throw them in the comments. Hey, thank you for spending this time with me. Please know that I appreciate you, and we'll see you in the next video.